Hello friends, welcome back to my channel Dental Minibytes, Basics to Mastery about all dentistry related educational videos. So today is a short topic on muscles of mastication. So we are going to see uh, what are the muscles of mastication and what is its origin, insertion and its action and also its nerve supply. So let's move on. The first muscle we are going to see is temporalis. Temporalis muscle, it has its origin on temporal fossa here. Temporal fossa including the frontal, parietal and temporal bone, and its insertion is on the medial side, that is inside of the coronoid process. So this is the origin and insertion of temporalis, and because of its insertion in the coronoid process, the main action is it closes the lower jaw or clenches the teeth. So the nerve supply is mandibular division of trigeminal nerve. This is about temporalis muscle. Then the next muscle is masseter. Masseter is it has two head. One is the superficial head, this one, and the other one is deep head. This red color is the deep head. So the superficial head, it has its origin from this. Both head has its origin from zygomatic process of maxilla, medial and inferior surfaces of zygomatic arch. Both has an origin from zygomatic process, and it gets inserted into the angle and ramus of the mandible here. Both head. The deep head is parallel to the mandible, and the superficial head is placed in an oblique direction to the ramus of the mandible. Then the action of the masseter muscle is it closes the lower jaw and clenches the teeth as same as that of temporalis muscle, and the nerve supply is also same, that is mandibular division of trigeminal nerve. Then the next muscle is medial pterygoid muscle. Medial pterygoid muscle, it has its insertion inside, that is inside of the medial side of the mandible, and it has its origin from the medial surface of lateral pterygoid plate. The sphenoid bone has lateral pterygoid plate, one has medial surface and one is lateral surface. From the medial surface, the origin of medial pterygoid takes place, and also from the maxillary tuberosity area, this area, and palatine bone, and it gets inserted inside of the mandible. See, this is the cut section of the mandible. So the medial pterygoid is inserted medially on the ramus of the mandible or angle of the mandible. The action is closes the lower jaw and clenches the teeth. So temporalis, masseter and medial pterygoid. These three muscles main action is it closes the jaw and clenches the teeth, and it is supplied by same the mandibular division of trigeminal. So the next muscle is lateral pterygoid muscle. It has its superficial head and inferior head. The superior head arises from the lateral surface of the greater wing of the sphenoid bone. This is sphenoid bone, its greater wing. So it arises from the lateral surface of the sphenoid bone, and the inferior head from the lateral pterygoid plate, that is lateral surface of lateral pterygoid plate. Medial pterygoid from the medial surface. Medial pterygoid muscle from the medial surface of lateral pterygoid plate, and the inferior head of lateral pterygoid from the lateral surface of lateral pterygoid plate. It gets inserted into the condyle of the mandible and also with the temporomandibular joint. This is the articular disc of the temporomandibular joint. So the insertion of the lateral pterygoid is on the articular disc and also the condyle. The only muscle which causes the action of opening the jaw and protruding the mandible is lateral pterygoid muscle. All other muscles of mastication has closed the jaw of closing the jaw action and also clenches the teeth. And along with the medial pterygoid muscle, the mandible moves sideways. If the jaw is placed on right side, then the activation of right lateral pterygoid and left medial pterygoid takes place. So the opposite. So the movement of the mandible sideways has happened because of both lateral pterygoid and medial pterygoid muscle, and the mandibular division of trigeminal nerve is the nerve supply for the lateral pterygoid. So this is all about muscles of mastication. So thank you.